for you. I'm joined by Heather Kretzer with the Department of Health in Bay County. Heather, how you doing today?
Doing pretty well. How about yourself?
You know, it's another beautiful day in the bunker here at News 13. Um, we saw that in the last couple of days the suggestions for masks have changed. The CDC has, I think, changed their recommendation. Tell us kind of what those changes are.
Sure. So the CDC is now recommending that persons wear a cloth mask when they go out into public, such as places as grocery stores, pharmacies, and things like that. When you're once a week, essential trips, where possibly you could not have that 6 feet of space that is.
Mm-hmm. What's the benefit of a cloth mask?
You if there's new research and new scientific data, and that's why the CDC has put out this recommendation. So that would prevent you, if you're asymptomatic, from spreading to someone else, and it can also offer some protection. Now, this is not meant to replace the social distancing measures that are already in place. So people should continue to practice, this 6 feet away from people when they do go out, limit times out in public only to essential purposes.
Yeah, so it's not like a silver bullet. You know, I wear a mask and I'm automatically sort of not going to catch this thing, right? I mean, I couldn't wear this and then start running up to a bunch of strangers.
Right, and it's really more to protect others from you when you're going out in case about it than it is to protect yourself when you're going out, although it does offer some protection for yourself as well.
Now, what's the difference between a cloth mask and we keep hearing about an N95 mask, and I think surgical masks as well.
Right.
What are the differences there, and who should be wearing which mask?
So the N95 mask and the surgical mask should be reserved for our medical folks, people working in hospitals, people working in the doctor's offices that are providing the testing. Department of Health, we're providing that testing too. As everybody knows, these are in limited supply across the world because everyone in the world is looking for these. So we need to reserve them for those healthcare providers. The cloth mask or something that people can make at home that are offered. There's a great video right there with the Surgeon General that's showing an example of how to make one of those. But there's some DIY instructions on the CDC's website where there's a sew version. There's a way you can make one with a T-shirt. You can make one with a handkerchief and a coffee filter. So there's a lot of different options that people can do, and those are the ones that are recommended by the CDC that are there, and he's kind of demonstrating there kind of how that works. So you want to make sure it covers your nose and all the way under your chin too. So he's
do I need to run out and get a face shield? I started seeing face shields around. What are those for?
Well, those are also for our medical providers. Not something that people in general need to get. I know people, panicked and do what they think is right to protect themselves. But the best thing to do is listen, and as that scientific evidence changes, the CDC is going to come out with updated recommendations.
All right. Now, what are some other ways to protect your family? I mean, we've gone over these before, but just one more time, what are still the sort of best practices right now for keeping you and your family safe?
Well, I mean, the best thing right now is to follow the governor's safer at home order. So people, especially people who are 65 and older, people who have underlying health conditions should stay at home. Other persons, they can reach out to a family member, a friend, a neighbor, somebody that can help them get their essential needs, their groceries, their medications. Other persons should be at home unless they're an essential employee. Obviously, some of those folks need to go out and go to work. Or if they're out for an essential purpose, such as buying groceries, getting medications, getting food. So those are, if it's something that meets your basic needs, essential things, that people still need to be able to go out and do. Limit those activities as much as possible, once a week if you can. And then, of course, we've talked some about cleaning and disinfecting. So that's something while we're all at home, daily cleaning and disinfecting commonly touched surfaces. So people, can even get the kids involved and make a fun game out of it. Put on some fun music and get them to help you out with that while they're at home. So that's some of the things that people can do.
All right. Well, Heather, I appreciate you joining us. I appreciate you guys for watching us again. We just wanted to give you some of that essential information. So thanks, everybody, and we will catch you next time.
Thank you.